we'll be talking about the why to vaccinate. As you know, there are different things that we are going to discuss throughout this lecture. The benefit of vaccination for the individuals, communities, and societies, understand the principle of immunity and how vaccines can work, and also the characteristics of some vaccines, common challenges to vaccination, and also the importance role of the healthcare workers, of you guys, in supporting the optimal vaccination coverage. See, when we ask ourselves why we need to vaccinate, I always use this slide actually to show the importance of vaccines, because we have high death rate from that can be prevented by the vaccination. And this is in addition to other complications there that we can also prevent through the vaccination in terms of the hospitalization, even outpatient clinic visit. And we have other indirect things such as the sick leave, and also the parents with the kids are infected, they have also to leave their work. So we have different social factors also that will be prevented and controlled by the vaccination. So the exception of safe water, actually. There is no other intervention in the history of humankind, not even antibiotics, that had a major effect on mortality reduction. So this is a key thing that we have to keep in mind, that vaccination is a major achievement of the human being. We do the vaccines to develop the immunity by stimulating the immune response. So we know, without going to details of the virology, but the key thing that when we expose to infections, either we will recover from this infection and our immune response will be strong to it, or we'll have disability or death from that infection. This is why we need vaccination, where we prepare the body for the responding to the vaccine, and this, if the vaccine efficacy is high, we expect that the subject will be immunized against that infection for a large scale. So vaccination, not just important for mortality. We have the hospitalization, as we mentioned earlier. We also have the other direct and indirect impact of the vaccination. But you can see the major impact and reduction of mortality globally from the vaccination. If you look at the strep, Dr. Hadil this morning made a great announcement that the Minister of Health has approved the BCV13, the strep pneumonia vaccination, and hopefully BCV13 will be in Jordan like sometime soon. So, and this is a major achievement actually for the Minister of Health. We congratulate them for that. And you can look at this curve. When the pneumonia vaccination was introduced in the US, you can see a major drop in the incidence of strep pneumonia. If you look also about the hemophilus influenza vaccine, you can see the major decline in the incidence after the introduction of the vaccination. I think you, Dr. Basim, and other colleagues at the pediatric departments, Dr. Weil, we have now the BCV vaccine, we have the rotavirus A, and hopefully the RSV vaccine will be coming soon. I think you guys will go home, so because vaccination is going to reduce the incidence for different infection at the same time. Anyway, but we can see a major impact actually of the rotavirus vaccine introduction in Jordan and the major drop of admissions from pediatrics. And this is the same for other infections. Varicella vaccination, we can see the major drop in the hospitalization. I encourage countries in the region actually to go in two directions, varicella actually, for the pediatrics and also for the adults above 50, because this is very important and it's had a major impact. But you can see here, when they start the neonatal vaccination for varicella, a major decline in the admissions. So as I said that we'd be looking for both the pediatric within the national program, because it will affect the whole immunity of the community, and also we need to focus on the high-risk groups. You can look at the vaccination coverage, and because most of the infections has been, and we have without eradication, but we have elimination, and this happened to polio, rubella, and measles, and we have also measles in 1996. Hopefully, the last year we had several outbreaks in the region, but hopefully they were contained, and hopefully we will not see again measles. I think in Jordan we are about to announce last year, but some cases came at the last moment. Eradication, until now we have the smallpox, or it was only to be eradicated. As my colleagues, Dr. Adnan Hadil mentioned earlier, we are worried about the polio and other infections with the current COVID-19, but hopefully most immunization stakeholders will be alert, and hopefully things will not see cases again or in the near future because of the current COVID-19. We can look at the impact of vaccination. Actually, once you increase the vaccination rate, you are going to affect also the infection rate. So as the vaccination uptake of vaccines are high, we'll have higher coverage throughout the community. We can see that we are talking about school children for the COVID-19, that they are back to school, although for me, I think we need to wait for a little bit, but this is the governmental decision to go back to schools. The risk of school children from influenza, from COVID-19, other infections actually, is the spread for elderly and other adult population. So in the States, actually, initially they were vaccinating the only elderlies for the flu. And they found actually when they started using the flu vaccine, also for pediatric age group, there was a major decline incidence of the flu among elderlies. So this is the same message that we are trying also to pass now for the elderlies and school children and with the current COVID-19 pandemic. This is the same as previous slide. Once you increase the vaccination uptake, the infection rate will be decreasing. And it's only, as we had fears at the early stage of this pandemic that from the interruption of the vaccination program, luckily that things were back to normal within a few weeks, around 6 weeks. Most of the national programs were acting efficiently in most countries in the region, because you can see here when they interrupted in Sweden the wholesale DTB vaccine in 1979 compared with Norway. Norway, they continued to do the vaccination while the infection incidence was low, while in Sweden, when they stopped the vaccination, the incidence started to increase dramatically. But after that, when they introduced the cellular vertices, the TB, the incidence started again, it was declining. When I was based in the UK between 2002 and 2010, most of us know about the MMR and all the community and the different people were acting on autism. And these things have actually affected the MMR vaccine, and it led to increase in the number of cases. Hopefully in our region, we don't have, we hope that things will continue also with the social media, other things we are aware about the vaccine hesitancy. Hopefully our community will be aware and alert for all false messages, and they will continue to have a high uptake of the vaccination. So we can see also about the infection rate. Actually, in many countries, it's compulsory to have the vaccine at the school entry, that the kids completed their vaccination program. And we can see that when it's not compulsory, the uptake rate will not be high. So we'll try to make it as possible as compulsory, because to protect the whole community. You can see even the coverage if it's not comprehensive. Like, for example, rubella, initially it was for adolescent girls, then later on it was for all age groups. So you can see that they introduced initially for adolescents, male subjects who were born around 1976. And when they were compared with females, they have much higher incidence of rubella because the vaccine was only for females. So when we vaccinate, the whole community will protect both males and females. Something to keep in mind, that the immune system initially we have start to increase with age and then to reduce again with age. This is why I encourage ministries of health, actually, in the whole region, to have adult vaccination program for elderly, for high-risk adults. In the UK and Western countries, in the US, it's a routine vaccination for all high-risk group patients for the elderly. We debate this with Minister of Health, and we encourage the load not to be especially financial with the Minister of Health. We need to encourage to have a system to have the vaccination for elderly, for the high-risk group patients, to be within the management system. Like we'll discuss this later on today about the importance of the immune response and the vaccination for elderly and adults. Vaccination during pregnancy should also be routine. Many countries, even now in some countries in the region, there's a routine vaccination during pregnancy, and we have to keep this in mind because the mother will be also protecting the baby, and we want to protect different infections like rubella and other infections for the babies and to protect the mother itself. And there's many infections when they happen, for example, measles or rubella, when it happen to the mother, actually the severity of the infection is much higher when compared with the kids when they get the infection. So during the pregnancy, the immune system will be different, and this is why we need to have either to check the immunity of the mother or to introduce the vaccination for mothers as a booster for them for different infections. In addition to the national immunization program, we always need to remember, as we discuss this also later today, that we need to look at those at high burden of infections from different existing medical conditions. As we said, and we'll discuss also this later about the mortality reduction, hospitalization for the mortality, morbidity, and also the severity of disease for elderly. The major also benefits for the vaccination is not just the eradication of infectious diseases. Also, they support the, as we said, control of other infections. Like, for example, we know the asthmatic COPDs will have exacerbations from infections. We can also reduce the resources used by controlling infections. We can also have herd immunity for vulnerable population. We prevent antibiotic resistance from vaccination. We increase productivity, reduce the work loss or also the kids' attendance to school. We encourage the safe travel, mobility, and extended life expectancy. So the vaccination has a major impact on the communities from different factors, and even it has from antibiotic resistance, from safe travel, economic factors. All these factors can also be attributed as benefits of vaccination. For kids from birth to 2 years, they live healthier, they have fewer serious illnesses, and also lower costs on the healthcare system and family. So it's actually this shows that the vaccination is not just have health benefits, also have a major economic benefits, and also it has a major benefit for the community itself. We know the vaccines we don't want to go through the difference, but just to remind you guys, we have the live attenuated, we have inactivated, and we have inactivated split, and we have inactivated toxoids. In the live attenuated vaccine, we need to consider, as you know, that the whole cell of bacteriovirus that have been treated to be reduced ability to replicate within the human cells, then the immunity, we have to consider contraindications in some populations because of the presence of live pathogen. So the examples of the live attenuated are MMR, OPV, and BCG vaccines. Then we have an activated whole vaccine. These are the similar to the hepatitis A vaccine and an activated B vaccine. And here we have the immunity stable over time, but boosters may be required for lasting immunity. So in this case, actually, we can assess the efficacy through seroprevalence at different age groups and decide whether we need to have booster doses or not. For hepatitis B, emergency influenza, and HPV vaccine, we have the inactivated split or subunit, and can be given to most people, but booster is likely to be required for lasting protection. And in case of the like tetanus, diphtheria, This is why we need to have regular boosters, because the immunity will not be lasting. And this is why, for example, we always ask about when we have injury, we ask about someone has, for example, different injuries, or for foreign body, we'll ask about the history of tetanus vaccination, or they have wounds, especially dirty wounds, we ask about the vaccination history, because we need to give booster if needed. Luckily, in our region, until this stage, we are we don't have a major issue from vaccine hesitancy, but it's a major issue in other communities. But factor that we need to consider that the influential as stakeholders, we need to consider the leaders, community leaders, stakeholders, representatives of the community. We need to look at the politics, geographical barriers, pharma industry. We have to look at different factors when we discuss the vaccines uptake and acceptance. And one of the examples to give you guys, we had one of the meetings, we discussed the flu vaccine. As you know, the similarity between symptoms of COVID-19 and flu, influenza virus infections. And this is why the government thankfully accepted to give the, at least for this year, the high-risk groups and pregnant women the flu vaccine in next month in October. And this will be given actually by you guys at the primary healthcare units in the country. And this is one of the importance to reduce the load on hospitals, and especially under fear from the COVID-19. So we always have to consider the social norm, beliefs, attitudes toward the vaccination, awareness about the vaccine, personal experience, perceived risk and benefit, and experience with advanced vaccination. This is why sometimes we encourage, for example, as Professor will discuss later this afternoon about the pharmacovigilance. It's important that we keep in touch with the patient, because sometimes family might have, the baby might have some ADRs from the vaccine. Maybe they will be reluctant to get the next vaccine. This is why we have to educate families about the possible side effects, when it's mild, when it's moderate, when it's severe, and what they need to do. This is very important actually to reduce the, to ensure that a high vaccination uptake. We need to ensure, as you and as vaccination officers, to have a good knowledge about the vaccine, so you can answer questions, you can answer misinformation from the parents, and you can assist them in this project. Also, we need to ensure that you need to have to handle the attitudes of parents toward the vaccines, and how and the social influences there. As a healthcare worker, you have a major duty actually to improve information, knowledge, to provide support for the parents, to do also training for your colleagues, and to ensure that we have high uptake. And you are the guy, you are in the field, you are the one facing communities, and you are actually the main soldiers behind the high vaccination uptake. So we need to consider the evidence, address concerns, and also support the vaccine uptake. Remember, key take-home message is that vaccination is not just reduce the global infection, but it will also save lives, resources, and ensure healthier community and more productive community. Vaccination are cost-effective public health interventions, and we protect our immunity, and we have different factors and benefits from the vaccination. Thank you very much.